Alhamdulillah.
So, Assalamu alaikum, everyone. My name is Saffana Hassan, and I'm an internist as well as an allergist in the greater city of Houston. I am hosting today's program for the Mercy Clinic through the Multicultural Center. October is Breast Cancer Awareness Month, and today's topic will be all about that. Let me first introduce you to our guests here. I have with me Dr. Sadaf Anwar. Dr. Anwar is a board-certified family practitioner and has been practicing in Texas for the last 20 years. She's married to a chemical engineer and has made Texas her home for the last 28 years. She's a passionate community organizer, and she's also the proud mom of 2 boys. I also have with me Sister Ashma Moosa. She is an RN. She has been working with the LaPorte Family Clinic for the last 28 years. She is also on the executive board member of the Rose, which is a nonprofit breast health organization. Sister Ashma is a breast cancer survivor and has been now breast cancer free for the last 10 years. Thank you to both of you for being here today. I hope to learn a lot from both of you.
Thank you for having us, and Assalamu alaikum.
So I would like to start with you, Dr. Anwar. What I would like for you to tell us is if you can let us know what the risk for breast cancer is and why it is important to screen for it.
Sure. So breast cancer is very common in females. Just to understand the magnitude of the problem, 1 in 8 females in their lifetime can develop breast cancer. And out of them, 1 in 39 can die of breast cancer. That is pretty significant. And then it is the second most common cancer in females in America after skin cancer. And among the cancer deaths after lung cancer, it is the second most common cancer-related deaths in America. So that is significant. And so it is estimated that in the year 2020, which is this year, it's estimated around 42,700 females will die of breast cancer, which is about, roughly speaking, every 2 minutes a female can die of breast cancer. So this is the magnitude of breast cancer related deaths. So that is pretty significant for females.
That's a very scary number, yes.
It is a scary number. Just being a female and being older, which is, when I say older, is just over the age of 50, we are at risk. It doesn't matter if there is family history or not.
I see, I see.
So
that's important to understand that the older we get, the more important it is for us to probably get screened then.
Yes, and yes, of course, there are certain races are more at risk, like Caucasians are after the age of, under 45, African Americans are at more risk, but after the age of 55, Caucasians are more at risk, but it doesn't matter. It doesn't matter, you can get, even younger, like 11% of breast cancers happen in younger females, less than age 35.
I see.
There is but still, we need to know how it is very important for females to know the magnitude of the problem.
Of course, we need to be aware of those numbers, and definitely. What are the signs to watch out for?
And before you just forget, you mentioned about the risks. So just few things before we go to the signs. So the risk factors, just to know, just few risks. There can be no risk, but some risk factors. Just having a first-degree family member, like having a mom, a sister, or a daughter with breast cancer increases your risk for breast cancer. And being on synthetic hormones, like a lot of us might have heard about Prempro or Premarin. If you have been on for more than 10 years, it increases your risk.
I see.
Yes, and then having multiple family members with cancers like ovarian cancer, breast cancers, it increases our risk. And if a female less than 30 years, if she was exposed to chest radiation, like if she had leukemia or lymphoma, that increases her risk later in life. Also, a female who had a personal history earlier in life with breast cancer, she can later in life develop it again.
I see. So they can have recurrence of that.
It can happen. And also earlier age, like if somebody was younger than 11 when she started her cycles, or she was older when she stopped having cycle, like older than 55.
I see.
She stopped having cycle.
So the longer they have had their period,
the more
the risk.
Estrogen.
Estrogen, yes.
increased potential, and obesity, alcohol, smoking, all of that, like unhealthy lifestyle.
I
That
see.
increases our risk. And a BRCA, we hear about BRCA1, BRCA2 genetic mutation, you know.
Those are the genes, right, right.
So, and then things that lower the risk is interesting. Having a pregnancy, full-term pregnancy,
Mm-hmm.
before the age of 30 lowers our risk.
I see, I see.
And breastfeeding.
I see, I see.
Breastfeeding our kids potentially lowers the risk.
Okay,
so
okay.
Some potential risks and benefits. Things that we can do or not. I mean, of course, it can happen to anybody.
Right, right.
There's some things that some studies have proven that might help.
Okay, okay. Well, that's good to know. That's a lot of information. So I was wondering if you could tell me what are the signs to watch out for. What should a female be concerned about?
A lot of times breast cancers are asymptomatic. That's why hence we say the word screening, you know, the mammogram, which is, you know, X-ray of the breast. But again, a lot of times we see it in our clinics, and all of you might also see that in your clinic too. A lot of times patients do come in, like in between those 1 or 2 years of, you know, their wellness exam, they come in and they notice themselves, you know, they found a lump. So yes, most breast cancers are painless and they're asymptomatic patients, you know, but there are sometimes patients. So things that females always we should also always emphasize the importance that females should do a breast exam themselves. The reason being, they should know how their normal breast feels like. They should be aware of their normal anatomy, what is normal and what's not. That's all. A lot of studies are actually now saying that there's no, when the clinicians do a breast exam, they are saying it's really not necessary. It's not.
I see. If a female actually knows their own breast, they will know whether a new nodule or something is coming up. I did want to touch on that. You said that painless lumps. So that means there are painful lumps like fibrocystic disease, right?
But the thing that they should know, like change in the breast size, change in the skin overlying the breast, any flaking, any redness, any change, any discharge from the nipple, especially like bloody discharge, that's not normal. And any swelling in the underarm, that's something they need to get it checked out. Any constant pain in the breast area, it's not normal. So anything that's not normal, it's good to get checked out. And also they don't need to freak out. A lot of times when they come to the clinician for all these things, they need to rest assured, get checked out, but hopefully a lot of times those are not necessarily cancer signs. Like retraction of the nipple, you know, dimpling of the skin around the nipple or skin, all of that can be signs, but not necessarily it's cancer. It needs to be checked out.
Okay, okay, great, great. That's good to know. Talking about that, should women be the only people that should be concerned about breast cancer, or is there any reason for men also to worry about this?
Oh, very interesting question. So 1 in every 100 breast cancer is male. So that is very significant.
That's a big number, actually.
It is very big. Yes, it is. It's a very interesting question, though. So think of that. If you look at the magnitude of the problem, it's 1 in 883 male will get breast cancer. That's big, I think.
That's a big number.
That's big number. And so they are saying that, or the study says that in the 2020, around 26,020 males will get breast cancer, and out of them, they are saying 520 will die potentially. That is the statistics. You know, this is based on the years of past.
Is it because it's caught at a later stage?
Most likely that, and I think that is the trend that has been, and the risk for males that can get breast cancer again will be almost the same as females, like having family members with breast cancer, having exposed to chest radiation before the age of 30. But on top of that is also hormone therapy. Back in the days, male with prostate cancer used to be treated with estrogen. Yes. That will increase their risk. And then if males had their testicles removed because of trauma, or any other, for whatever the reason might be, if they had no testosterone exposure, will increase their risk. And liver problems will also increase their risk. And then and then same obesity, overweight. So all of, and of course there are same thing, no reason. So they should be also aware if they find a lump, so they should be also.
They definitely need to reach out to their physician. Definitely.
It's not as common, but then again, it is a definite possibility. Yes, ma'am.
Okay, okay. So what recommendations would you give for women and their families?
Oh, so it's the screening. So breast cancer screening, of course, as we talked about in the beginning, being a female and being older female puts that as risk. Will breast cancer happen in a young female? Yes, it can happen to somebody who is younger than 50. 11% of breast cancer can happen in a younger female. Will we do a mammogram in them? No, because mammogram is X-ray of the breast, simply speaking. It's an X-ray and it exposes us to radiation. So if you start doing mammogram in a young 20-year-old, by the time they're 50, 60, lots of X-ray radiation. So we can do that. So if there is family history risk, so we have to assess that. So now coming back to the bulk of screening, which starts at around 40. There are two different societies, American Academy of Family Physicians, the OBGYNs, and AMA, and all of the United States Task Force. All of them have different opinion. Roughly speaking, over the age of 40, all females need to go to their primary care provider, which can be their internist, OBGYN, or family physicians. And
yes,
they all have to assess because, as I said, there is a difference of opinion. Some societies say every year, some say every 2 years, between the age of 40 and 50 for average risk females.
Right.
Every 2 years. Most of them say every 2 years. From 50 to 75, actually, they say every 2 years is acceptable. And over the age of 75, if the life expectancy is good, like if they're vigorous and healthy, they can still go and for mammogram, depending on their physician and the patient's mutual understanding, but there is no recommendation over that age.
I see.
Because, when we do a screening, we're looking for cancer, but the chemo is something not everybody after a certain age can tolerate.
Right, right.
And then patients with risk factors like family members with breast cancer, they need to start early. Again, after 40, they definitely need to screen everybody. But with family members with breast cancer, first-degree family members, definitely need to start early on.
I see. Okay, okay. That's a lot of great information. Thank you so much, Dr. Anwar.
Thank you for giving me the opportunity.
So, Sister Ashma, let's talk to you. Will you share with us your feelings after your breast cancer diagnosis? What would you say was the most important support during and after your diagnosis?
Well, in my case, speaking for myself, having the breast cancer prior to that, I had already gone through thyroid cancer. And I think the best support that I have in my life is my husband. And he's my best friend. He was there like a rock for me. And also my children, actually. My children are the one who got me through some of the very bottomless days that I had, that I thought I was sinking, but just having my children around me and making sure that I let them know what I'm going through, and we never really hid anything from them. So you'll be surprised how resilient your children are when you're going through something like this, and what a great support that is for you emotionally. So definitely my closest and my dearest were the most supportive.
Right. Initially, when you got diagnosed, what were your feelings? Were you scared? Were you confused? And when did that start changing to positive feelings like, I can beat this, I can do it?
Right. So let me tell you how I found out. That might give you a little perspective. I have always been very vigilant with my health. I always get my well woman checks right on the dot. So this was, I think, my fourth mammogram in the 4 years. And when I went for that mammogram the fourth time, I don't know, I had this little nudge in my heart that it didn't seem right, And it was a Saturday afternoon, and normally we just having fun with the kids, making food. And here the phone rings, and I get a call, and my husband picked up the phone, and I could hear that he was getting more serious as he was speaking. And Dr. Malala from the Rose called because she noticed the name, because we refer quite a bit to them. And so she first asked him, is she related to you?
I see.
With the last name. He says, yes, that's my wife. So she told him that I want you to bring her in on Monday morning, and I want to do a biopsy. And I could hear that silence, and I knew right away that something was not right. So we both went completely silent. The kids were still, running around, and they were young at that point. Fatima was 13, and my son was like 7 or 8. And so we quietly then later on talked to each other about it. And I told him, I said, I know I have to go there Monday. I don't know what we're going to be faced with, but I know one thing, that I am going to completely give this to my creator and let him guide me. And I also told him, I said, we're not going to not tell our children, because part of our faith teaches us that living and dying is part of life. So if you don't talk to your children openly about this, then you're actually not doing a good service to them, to how to handle a situation like that. So we did, sat both of them down and said, Mommy has found out that she has cancer. And of course, the word cancer immediately gives you this kind of the kids get this kind of a nervous feeling. They don't know what it is, but so we explained to them, Mommy has a lump in her breast, and she's going to go and get her biopsy, where they're going to go in there with and we explained whatever minimum that you tell a child.
Right.
So I went in, I got my biopsy, and Dr. Dixie Malala is such a kind-hearted woman, and she's so amazingly brilliant at doing these biopsies. So I quietly asked her, as I was putting my clothes on, and I was looking at my tissue sitting there, and I asked her, I said, what do you think? And she told me, my dear, it doesn't look too good. So I wanted to prepare myself. And so initially I kind of broke down, but then I thought, no, let's move on with this. And then, of course, I did my research very methodically. What if I'm faced with, is it going to be a small lump where I can get away with a, lumpectomy, or is it going to be a large lump? Do I need to do a mastectomy? So I was reading up on a lot of things, and I'm just that way. I just very methodically wanted to prepare myself for what decision I need to make. And that's another thing, is that women have a lot of choices now with breast cancer. Some women, if they have an aggressive lump, they feel that even though they would probably recommend a bilateral mastectomy or a taking one breast out and not the other, women usually make their own choices what they want to do. So that is in another episode. Maybe we can talk more about it, self-image and all that is concerned. But I went to MD Anderson, of course. Dr. Huck was my physician. And he told me, he says, I really feel that you need to go get a recommendation at MD Anderson. So I went through the whole system there. And I was told that my lump was small enough, it's early, and it can be taken out, do a lumpectomy and do radiation. But for some reason, when I walked out of there, I just felt this kind of a uneasy feeling. I didn't have peace with that prognosis of what they were going to do.
I see.
So I, of course, wanted to know more about it. And so and again, I'm fortunate that we have a medical community, that we, have friends in the circle. So I was able to contact, a plastic surgeon who actually does these type of surgeries with breast cancer women. And so I went to speak to him, and I said, what if I chose to just do a bilateral mastectomy? Because I am not finding peace in the lumpectomy. This is my second primary cancer, and I don't feel that I want to sit there and wait and see if the other lump might show up in the other breast. So he told me, he says, the reason why I went into plastic surgery is because of a lady just like you that came in, and she was young. And there is a procedure where you can, you know, get a bilateral mastectomy with you, and they can do reconstruction with your own tissue.
I see.
So I asked him more about that procedure. And yes, it's a very extensive procedure, but again, I was looking at the future of how can I bring my odds down? How can I bring less surgeries along the way? And this particular procedure is, once you do that, you don't have to worry. There's no foreign body. You use your own tissue to rebuild you. So that's the procedure I chose to do. MD Anderson was not too happy. The outcomes are the same, whether you do a lumpectomy and radiation or whether you do a bilateral. But traumatically, I think that what they were trying to tell me is that, how are you going to face this when you can just get away with a lumpectomy? And again, you know, I just went with my gut feeling. And sure enough, after surgery, the good thing was it wasn't in my lymph nodes. I went under surgery. I was under about 16 hours. So they did a bilateral mastectomy with the transplant at the same time. And come to find out, after the surgery, when you get your biopsy, the surgeon actually told me, she said, you know, we would have actually removed that one breast completely, because the cancer, the lump, was actually outside the margins, and it was a HER2 positive, which is a very aggressive cancer. So what you chose to do was actually, you know, at an advantage for you, because now you have, you know, that's another thing. When you have a unilateral, you know, mastectomy, you just don't feel as a complete woman. So, you know, I felt like I went with my gut feeling, alhamdulillah, that's it. I'm done. I'm going to be on my way. Right. So it's amazing. Again, the science is so advanced that nobody should be scared of how much they can find out so early. And with the biopsy, they found out that the kind of cancer that I had was a HER2 positive, and there is a chance that this can come back, because
I see.
Yeah, it's a very aggressive type of cancer. But they do have chemotherapy and Herceptin, which actually goes after that particular protein. So Dr. Ibrahim at MD Anderson, a gentleman, he sat me down and he said, you know, if my wife had this, I would recommend for her to do chemotherapy. And he says, I presented your case in the tumor board, and we had 10 physicians, and 8 of them said, she can get away with it. She doesn't need chemotherapy. But he said, you know, myself and another physician said, no, we should go ahead and recommend chemo. So that is the time when I completely crumbled, thinking all this I have done, I've, you know, kept myself strong. And that's the time I really broke down, when the word chemotherapy came, and I had to do it for 1 year. So chemo was not easy. But again, I went in with a fighter warrior mode and focus. And you kind of have to put everything aside and not worry about other things. You just have to focus on yourself. And that's how I got through with the surgery, the chemo, and alhamdulillah, here I am after, this is my 11th year of survivorship.
MashaAllah, MashaAllah. So happy to have you here with us. Yes. So actually, you kind of touched on my second question that I had, which was, how has this changed your life and your outlook? So if you want to just maybe just let us know.
It definitely, I had to do a lot of thinking while I was, you know, going through chemotherapy. I'm a very active woman, you know, supporting my husband in his practice. And as it is, we both are very active, but I really had to reflect. And I thought to myself, and I did a lot of prayers, and I asked Allah, I said, you know, if I can get through this, I need to serve. And how do you serve? Is whatever you have learned from your experience, you bring that out to other women. So my whole focus is to empower our women. And again, doors opened left and right for me, and my purpose started to grow and grow and grow. And one of the greatest and most satisfying is that I was able to shatter the glass in our community, especially in our Muslim community, in the mosque, to bring this out. And I really thank Clear Lake Islamic Center, Dr. Bisuni, for giving me that platform as a woman, as a Muslim woman. So that has been the greatest thing for me, a satisfaction that I'm able to get our women to come and talk to me now. They're not as afraid. They're, you know, it's a taboo subject. So alhamdulillah, and of course, involved in every possible nonprofit that serves, you know, anything to do, not just with cancer, just generally.
Right,
that's our passion.
You're a very busy lady. We know that.
So that's where the passion is. And of course, I'm sure you want me to talk about the Rose.
Yes,
and how I
please
got
do let
with
us
that.
know about the Rose. And
because that's a very important organization. It's actually, I really find the Rose as a true ministry, in a sense that, you know, this was started by two women, of course, Dr. Dixie Malello and Dorothy Gibbons, the two women started this organization, a nonprofit. And when they first started this, they went to a banker and asked for a loan, and the loan officer actually laughed at them, says, "This is not going to work." And so, but they, you know, stuck to it. Their vision was there, and they started this organization to serve women that have no insurance. And how can they get that mammogram done? A simple diagnostic test will be able to tell so many things and save lives. So what they did was they started this organization called the Rose. And of course, the Rose has a lot of history of why the name came about and all that. But their main mission is every 3 women with insurance, and I was one of those women that had insurance that went there. Every 3 women with insurance will pay for that one woman who is unable to pay, or she is a single mother, she doesn't have any insurance. She may be working, but maybe she's not able to afford that mammogram because she has to feed her kids, rather than spending $250 for a mammogram. So this is where the Rose comes in. And when I was invited to be on the board with them, I was so honored, and it really it has a very soft spot for me, because there's so many stories that come to the Rose, and amazing work they do. And so another thing is that our South Asian Arabic women do not want to go and get a mammogram. Mm-hmm. I have literally put them in the car and taken them myself, because you know why? They had a fear that what if they find something? And I assure them, I said, you know, even if they find something, the most important thing is early detection is the key to survivorship. So I give them that spiel, I get them in the car, we go, and then by the time they're done, and sure enough, the following year they do make their appointments, but I have to get to that point with them. And so I want to continue doing that. And this is one of the videos I hope you will share with our community. And with, you know, both of us here as the physicians, you know, what she's saying, and you know, they're the gatekeepers. the frontline gatekeepers are the ones that see the women that come in, and all of a sudden they feel this lump. What do we do now? And so it's very, very important. And so there is resources out there. You're not alone. One message, if I can get across.
I would like to ask you, Sister Ashma, if you could say something to the family members of the women of our Desi community.
Yes, I have come across many Desi community women, especially if they find out they don't want to share this diagnosis with anybody, or maybe they're suppressed by their spouse saying, no, we don't need to share this. I can understand, you don't have to share it, but you must share in the sense that when you're going through something like this, you should reach out to people that are going to actually help you in the sense of support you and get you through this. Because there's so many questions, there's so many things that when you get diagnosed with breast cancer or any cancer, there's so many things that you need to prepare mentally, physically, emotionally, prepare your families, prepare your children, prepare your husband, prepare yourself. Self-care is very important. So if anything, please, you are not alone. Absolutely not alone. There is always somebody out there that has gone through this that will make your journey a little bit easier. And that's what I'm here for.
Thank you so much to both of you. I have learned so much from both of you today, and about breast cancer awareness, about recommendations, about resources, about the feeling that one goes through once diagnosed, and also the support that one can have in this community. Really appreciate it, and I hope our community here will benefit from this talk, from this discussion today.
And this is October a month. There's several online Facebook, Zoom programs. I'm actually doing 2 programs, one with MCC coming up. So please tune in and watch for that program.
Can you give the date for that, please?
Yes, we are set on the date. That will be on your website on the MCC. My personal annual event that I'm doing for the Rose that I give back is going to be October 25th. And that again will be on Zoom. And I really ask people to open their hearts and support this organization or any other organization that empowers women. This is very important for us to empower women should empower other women.
Absolutely, absolutely.
Yeah.
Thank you so much, Dr. Anwar and Sister Ashma. Inshallah, you all have a great rest of the evening.
You stay healthy, both of you ladies, especially Ashma.
No,
you too. Thank you for doing this. I mean, again, coming together as women is very, very powerful.
It is. You both take care, okay?
Assalamu alaikum.
Assalamu alaikum. Assalamu alaikum.